Thank you for your interest in MonaLisa Touch, a new and exciting technology for treating vaginal atrophy that can occur due to menopause or childbirth. We know laser therapy is effective. Our doctors, Pierman and Galvin, have experienced it, and we've been treating patients since February 2017 with great results.
I was diagnosed with breast cancer at 29. I had gone through 2 surgeries, radiation, was put on tamoxifen, and started experiencing all of the side effects of tamoxifen, which included vaginal dryness and atrophy.
Hot flashes and dryness and painful intercourse.
I was having a lot of pain with intercourse to the point where I just stopped being sexually active.
We were having no sex at all, none. And, it really was detrimental to the relationship because, here you have your partner who is looking at you like, what is wrong with you, or what is wrong with us? Is there a problem are you not attracted to me anymore? It's really hard not to be able to have, sex with the person that you love.
I tried multiple things. I did the patch, I did creams, I did oral medication, and I just stopped doing it because of all the controversy.
This treatment is life-changing. It is something that you can do without feeling scared that it's going to make your breast cancer come back or cause other health side effects.
And there's no drugs involved, so you don't have to be worried.
There's no pain, no discomfort, and I definitely saw results pretty much immediately.
The treatment itself is totally painless. It just feels like a little bit of a vibration. After that first treatment, I had results almost immediately. I mean, within a few days, I could tell that things were functioning more as they should be.
Well, I would say I'm 90% better.
My message will be definitely try the MonaLisa. It's worked for me.
I would recommend it to any woman who had any kind of concerns about vaginal dryness or atrophy.
The improved intimacy definitely impacts a lot of aspects of my life. I'm happier, he's happier.
I mean, I would say go for this because this will fix it.
Treatment is done by doctors, not support staff as often done elsewhere, which cannot be understated. Our physicians are trained on the appearance of normal vaginal anatomy. Laser treatment addresses vaginal atrophy. Symptoms usually start around menopause or sometimes in the postpartum period. Before laser treatment, vaginal atrophy was treated with some form of estrogen, either injected or used topically, as well as lubricants to ease vaginal dryness and improve intercourse. Laser simplifies that process. Initially, the MonaLisa Touch laser was developed for breast cancer survivors who could not use hormone therapy. Researchers quickly determined the laser helped any woman suffering from vaginal atrophy. After significant research, our physicians decided to bring MonaLisa Touch to Rockhill Women's Care because the scientific results were overwhelmingly positive in comparison to other products on the market. We treat both internally and externally. Vaginal atrophy affects the tissue in the vulva, the vagina, and the urogenital system. Postmenopausal women not only experience dryness and vaginal irritation, they also are susceptible to UTIs, urgency, discomfort, and leakage. After we treat the vagina, we treat the vulva, starting from above the clitoral hood, over the entire clitoris, the labium, and the vaginal opening. We want to improve all tissue quality. Most importantly, there have been no complications. This is not a drug. There is nothing artificial. The laser creates a pattern of tiny micro-incisions that penetrate through the skin. The incisions stimulate the body's repair mechanism. The treatment is so safe and easy that it is conducted in our office with no anesthesia or downtime. The procedure is fast, with no downtime. The specifics before, during, and after the procedure are specified on the slide. If you have further questions, we have professionals who can answer them. The pictures show the vaginal epithelium of a patient prior to the first treatment and 2 weeks after the second treatment. There is a striking difference in the cell structure. That flat, dark purple surface layer in the before picture has inactive tissue that lacks moisture or blood vessels. After treatment, the surface layer thickens, and there is moisture inside the cells. When we restore the normal collagen level, the connection between the cells becomes spring-like again, so they can stretch just like in youth. Tissue is more elastic, so sex is more comfortable. The treatment also improves the urinary symptoms of frequency and urgency. There is an ingrowth of new blood vessels and normal protective discharge that restores the vaginal pH to a premenopausal state. This reduces the chance of vaginal infection. With the laser, pH is restored, which encourages the growth of good bacteria lining the vagina. That means decreased vaginal and urinary tract infections. The chart shows urinary improvement after 3 treatments. The blue line represents the baseline, and the gray line shows the impressive decline in symptoms. The chart shows vaginal improvement after 3 treatments. Again, there is an impressive decline in symptoms. MonaLisa Touch is primarily intended for menopausal women. We're also treating women in their 40s who have issues with vaginal dryness. This treatment is also perfect for breast cancer survivors because they can't take estrogen, or for women who don't want to take estrogen, or are taking it and still are not satisfied with their vaginal function. We have also used it for episiotomy pain after childbirth. Women who have cervical or vaginal lesions may not be candidates. We do not treat women with an infection or if they are pregnant or recently have delivered. Those with an anatomic abnormality are not good candidates. Minor degrees of prolapse are not a problem. Those who have had reconstructive pelvic surgery with mesh or implants are probably not candidates. If you've had a biologic sling, you may possibly be a candidate. People who have had pelvic radiation are not candidates. There's now data that it is safe for those on anticoagulants, but we currently do not recommend it. Ideally, we prefer people who have none of these severe problems because we want good results for everybody. That's why we begin with a consult to determine if this procedure will be beneficial. To be a candidate, you need an up-to-date pap smear. If you come from outside our practice, bring your records and your most recent pap smear so we can have a quick consult. We can accomplish both the consult and the treatment at the same time. The treatments are 6 to 8 weeks apart, 3 in total. In some cases, 4 are needed. To maintain results, 1 treatment every 1.5 to 2 years may be necessary. Rockhill Women's Care has a great laser package. To summarize our competitive differences, only our medical doctors and nurse practitioner who are certified and trained in this procedure perform the laser treatment. We do not entrust the laser or your health to assistants and estheticians. We offer an additional treatment session for the same package price, should a 4th be necessary. We treat both inside and outside the vagina for improved sensation at no additional cost. We use a laser brand that is backed by a huge amount of research and especially made for treatment of the vagina. Our patients from Rockhill Women's Care have had great experiences with MonaLisa Touch. The cost includes the initial consult and 3 treatments, or 4 if needed. The consult and first treatment may be scheduled simultaneously to save you time. Your Rockhill Women's Care staff will provide the details about treatment cost and potential FSA and HSA coverage. $1,700 is your cost for up to 4 treatments, which includes the external treatment of the vulva. Should a touch-up be required in 18 to 24 months, the cost of a single treatment is $600. Become yourself again with MonaLisa Touch.